morning, everyone, and thank you. It is so good to be back, and thank you so much for all the well wishes. Hubby and I are doing well. Thank you so much. So this month is they have a lot of health topics this month, but specifically, I'm going to be covering two topics that has been the statistics have been pretty high, and today I'm going to be covering on mental illness. I'm going to be revisiting that. And then, of course, we'll be doing breast cancer at some point during the month. Pastor Henry and I will speak about when, because it is very prominent and very high, especially in the islands. We're noticing more and more of that. So today, as I discuss, we're going to be talking about mental illness, something we cannot shy away from, and we need to talk more about it. So as my screen loads, please bear with me. So what is mental illness? Mental illness, also called mental health disorders, refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. They change your mood and can make it difficult to function at home, work, school, or in your community. It is important to note that having poor mental health doesn't always mean you have a behavioral health disorder. You can also have a behavioral health disorder and still go through long periods of good mental health. So what is the risks for mental illness? Some of them are people that use alcohol or recreational drugs, people that don't get proper nutrition, don't have a support system of friends or family members, have a traumatic birth, or were born from a high-risk pregnancy, have a chronic medical condition such as cancer, diabetes, or hypothyroidism, just to name a few, having family history of behavioral health disorders, having neurological disorders like Alzheimer's disease or dementia, having a sleep disorder, having extreme stress in your life and don't know how to manage well, have had a traumatic brain injury, have had traumatic life event, or a history of abuse, struggle with your spirituality or your beliefs. So are there different types of mental illness or mental disorders? Yes. There are more than 200 types of mental illness and disorders. A few of the most common types of mental health illness disorders include depression, mood disorder, anxiety disorder, schizophrenia, bipolar disorder, eating disorders, addictive disorders, obsessive-compulsive disorders, personality disorders, which include borderline personality disorder and antisocial personality disorder, as well as post-traumatic stress disorder. And this is just to name a few. So what are some of the signs and symptoms of mental illness? Signs and symptoms of mental illness can vary depending on the disorder, circumstances, and other factors. Mental illness symptoms can affect emotions, thoughts, and behaviors. So examples of some of those signs and symptoms include feeling sad or down, confused thinking or reduced ability to concentrate, excessive fears or worries or extreme feelings of guilt, extreme mood changes on highs and lows, withdrawal from friends and activities, significant tiredness, low energy, or problems sleeping, detachment from reality, delusions, paranoia, or hallucinations, inability to cope with daily problems or stress, trouble understanding and relating to situations and to people, problems with alcohol or drug use, major changes in eating habits, sex drive changes, excessive anger, hostility, or violence, suicidal thinking. Sometimes symptoms of mental health disorders appear as physical problems such as stomach pain, back pain, headaches, or other unexplained aches and pains. Some of the warning signs in children and teens that we need to focus on is mood changes, physical harm, intense feelings, behavior changes, physical symptoms, and sleep problems. We need to focus on those a lot with kids. So how are mental illness disorders diagnosed? It is important to get a diagnosis specifically from a healthcare provider who specializes in behavioral health disorders. You need an accurate diagnosis to receive the right treatment. A healthcare provider will carefully review your symptoms to evaluate your mental health. Be sure you're able to tell your healthcare provider, or even your loved one is able to speak to the fact if there are any specific triggers that make your mental health worse. If your mental health problems are chronic, ongoing, or if they come and go. When you first notice changes in your mental health, there aren't any medical tests that can diagnose mental illnesses, but your healthcare provider may perform tests such as blood work or imaging exams to rule out other conditions that can affect mental health. So treatments that they have includes medications, psychotherapy, alternative therapies, and brain stimulation therapies. So some of the alternative therapies that a lot of people practice, and you see a lot of these areas are getting crowded, is like in yogas, acupuncture, um, massages. Some people do herbal remedies, all things that you can also speak to your healthcare provider about. So men versus women, is there a difference? Yes. Women have a significantly higher frequency of depression and anxiety in adulthood, while men have a larger prevalence of substance abuse use and antisocial behaviors. Women also have a higher prevalence, I just discussed the whole depression due to genetic and biological factors. Men are more likely to be diagnosed with substance use disorders and antisocial use, right? But they are more likely to die by suicide than women because of their mental illness. Men may have trouble expressing their feelings and seeking mental health care. Men are less likely to seek mental health treatment than women. The earlier treatment begins, the more effective it can be. And just to stay here for a little bit, one of the issues, problems also is that because we expect that men, they shouldn't have emotions, they shouldn't feel, they shouldn't be going through things. People like to tell them to man up, but remember that they're humans just like us women. And so when they're going through, the important thing is that they have the support that they need, just like us. So 40%, the biggest cause of mental health illness in men lives is usually work pressure. If they don't have a job, if there's a financial problems, or if they have any kind of health issue, a lot of them struggle tremendously in that. So how can family and friends help, and those that are of us around can help? If your loved one shows signs of mental illness, have an open and honest discussion with him or her about your concerns. Don't be judgmental and don't stereotype. You may be able to force someone to get professional care, but you may not be able to force someone to get professional care, but you can offer encouragement and support. You can also help your loved one find a qualified mental health professional and make an appointment. You may even be able to go along with them to that appointment. If your loved one has done self-harm or is considering doing so, take the person to the hospital or call for your emergency help. A reminder, most people with behavioral and mental health disorders can manage their symptoms. They lead fulfilling lives with the right treatments. Some people will need to manage mental illness for the rest of their lives. Others find that symptoms improve as they get older. Overall, mental illness tend to peak in young adults to up to age 25, then diminish greatly after age 50. Mental illness can also increase your risk of certain health conditions, such as stroke, type 2 diabetes, and cardiovascular disease. Getting an accurate diagnosis is the first step toward managing your mental health illness disorder. Talk to your healthcare provider if you or your loved one or child show any signs or symptoms. It is important to know that suicidal thoughts and behaviors are common with some mental illnesses. It is estimated that 703,000 people around the world died by suicide because of mental illness. If you think you may hurt yourself or attempt suicide, get help right away. Call your local emergency number immediately. Call your mental health specialist. Contact your suicide hotline. Here in the US and Canada, you can call or text 988. And that line is available 24 hours, 7 days a week. Or use live chat. Services are free and confidential. In Jamaica, there's an 888-639-5433 number or 876-838-4897. Or for child or teen, there's SafeSpotJamaica.com or 876-439-5199. You can call, text, and chat online with them. Seek help from your primary care provider. Reach out to close friends or loved ones. Contact a minister, spiritual leader, or someone else in your faith community. Suicidal thinking, mental illness does not get better on its own. So get help because you matter. I want to give special acknowledgement to psychiatry.org, the NIH.gov, Mayo Clinic, Cleveland Clinic, 988.Canada Suicide Crisis Hotline, and JIS.gov.Jamaica for the information that I shared with you today. I hope this was helpful. I ask that we utilize this information to support those that are around us. And please remember that the church is a spiritual emergency room where we can help our loved ones. God bless you. Enjoy the rest of the service.